Trigeminal neuralgia is a chronic neuropathic pain syndrome. The condition causes excruciating pain to the face. It is the most painful condition known to modern medicine. It is an extremely rare condition affecting an estimated 1 in 200,000 people, and it strikes women and men, young and old. People with trigeminal neuralgia are warriors. They fight an endless battle with horrible pain. These are some of their stories.
My name is Mary Lewis, and I'm 66 years old.
My name's Tamara McCourt, and I'm 46 years old.
My name is Kathleen, and I'm 41 years old.
My name is James Clapper, and I'm 41 years old.
My name is Linda Van Oost, and I'm 41 years old.
My name is Sandra Knutson, and I'm 40 years old.
My name is Gina Turner. I will be 35.
My name is Emily Patchkey. I'm 25 years old.
My name is Katie Rose Hamilton, and I am 15 years old.
My name is Will, and I am 13 years old.
I am Elena Jackson, and I'm 11 years old.
Each of these warriors has had brain surgery in an effort to relieve their pain. What kind of pain would lead someone to such extreme measures?
It's terrible pain. I get it in my teeth, I have it in my jaw, my sinuses, now I have it in my eye since these past surgeries. It's just, it feels like raw nerves in my teeth exposed. It's pretty intense.
Totally sucked the life right out of me. I don't know if I would have wanted to live with that.
Before, I could not touch my face at all without basically crumbling to the ground screaming.
It's like electrified carving knives being stabbed in my face over and over again for hours.
It feels as though you're being branded or burned or scorched with an iron.
I thought I was dying. I never told my parents that until my surgeries, but I thought either they didn't know I was dying or they weren't telling me.
That was just a new kind of torture that I would just never imagine would even be possible without the actual physical damage taking place.
Misdiagnosis is very common among TN patients. It is practically a symptom of the condition itself.
It took me so long to get a diagnosis.
It took me a year to get diagnosed, and before that I was misdiagnosed with TMJ, root canal cavities, tooth sensitivity, headaches, migraines, hormonal imbalance, sinusitis, ear infections, eye infections, you name it.
It took me 2 years to get a diagnosis, and before that I was diagnosed with TMJ and an abscessed tooth.
It took me 3 years to get a diagnosis, and before that, I was diagnosed with basically being a wimp.
They gave me Haldol, which is a psychosis medication for schizophrenic type patients, and they thought I was crazy.
I saw everything from primary care physicians, chiropractors, acupuncturists, physical therapists, pain management doctors, ENTs, and I received diagnoses from ear infections to TMJ. I had tubes placed in my ears. I was given antibiotics over and over and over again for ear infections that did not exist.
My doctor at first was very kind, very willing to help me. He gave me pain medication, and when it didn't work, he upped it. When it still didn't work, he switched them around. When it still didn't work, he gave up on me.
Not only is there no cure for trigeminal neuralgia, there is no medicine that is effective against it over time. These warriors know. They've tried them all.
Baclofen,
Butorphanol,
Carbatrol,
Klonopin,
Cymbalta,
Dilantin,
Dilaudid,
Furacet,
Gabapentin,
ketamine,
Klonopin,
Lortab,
Lyrica,
morphine,
nortriptyline,
oxycodone,
Percocet,
prednisone, Scalaxin,
Soma,
Tegretol,
Tobamax,
Toradol,
Tramadol,
Valium,
Vicodin,
Xanax,
Xanaflex.
Are there side effects to any of these medications? just a few.
Describe the side effects of the meds you took.
The medications made me exhausted, depressed, uncoordinated, so I walked into things and my thinking was so foggy I couldn't do basic schoolwork and would sit down and cry whenever I did basic math problems.
I forgot stuff, tired. I had to stay home. I couldn't go to school because of the pain because the medicine didn't help my pain. And I was tired, so I had to just sleep all the time. And some of the medicine made me crazy and I forgot the stuff.
They make me a complete zombie. I'll get double vision really bad to where I can't drive. Vertigo, pretty terribly.
Nauseated, unable to have a conversation, have double vision, unable to drive, or walk at sometimes, very dizzy, and just some medications just make you very sick.
They make you sweat at night, break out in hives, dizzy spells, make you really nauseated, constipated, which is real fun, memory loss.
Nausea, dizziness, and loss of cognitive ability.
Tired, weak, shaky, nauseous, dizzy, uneasy.
Tired, confused, forgetful, and messed up my thyroid.
Every aspect of the patient's life is affected in some way. The condition splits their lives into two pieces, the before and the after.
Before TN affected me, I was an accountant for a credit union and I worked in the banking industry for about 7 years.
Before TN, I was a data and voice networking consultant.
Before TN, I was enjoying life.
Before TN, I was a licensed daycare provider in my home, a full-time mom of 3, and a wife to my husband, Dale.
Before TN, I was very active in the music community, attending several music events every week.
Before I was diagnosed, I was a happy mother, working in a warehouse, trying to achieve my dreams of being a tattoo artist.
Before TN, I was a physically active mom of 2 children, very heavily involved in homeschooling them, and I was very heavily involved in the community around me.
Before TN, I was a competitive basketball player.
Before TN, I was a singer-songwriter.
Before TN, I was a student, a daughter, a sister, and a friend. Through TN, I lost many friends because I just didn't go out at all. I was scared that the wind would set off my pain.
I'm unable to teach. I've been a teacher at a high school for the past 18 years. It's the heart and soul of who I am. I knew that when I was young that it was what I wanted to do. I truly love it with all my heart. And I've been unable to do it for the last 2 years, and it's very difficult.
Before TN, we would go to concerts all the time, and, the beach. I live 100 miles from the beach. I love the beach. It is my favorite thing in the world, and I still love to go, and I still enjoy it, but I'm always have that fear that the sun hitting my face, the wind hitting my face is going to cause an attack, and I, of course, have to take scarves with me everywhere I go, just in case.
I've had to limit most of my activities because of TN. I had to quit playing basketball, which I miss very much.
Sometimes I have to cancel my plans. You have anxiety attacks trying to go out and do something because you never quite know what's going to happen and what you're going to do. The impact of this disease on your life is not just physical in nature, even though you can't see it, but it also has a very strong mental hold on you, even after you've gone through surgery and have had somewhat of a successful recovery.
I've had days, I've had weeks, I've had months, up to 3 months, where I couldn't even get out of bed because the pain was so severe. I definitely had suicidal thoughts many, many, many times. The only thing that stopped me from actually committing suicide was knowing that my committing suicide would create even more pain and suffering for my husband and for my children.
Feeling like a failure as a wife and a mother is something that's hard to wake up to every day.
Makes it a little difficult because I'm not able to do the things that I was once able to do. I don't go anywhere without having pain meds and water on me in case I have a flare. Going to work sometimes is a challenge. I spend probably 30 to 45 minutes in the morning doing heat therapy and taking pain meds just to be able to go to work and try to have a somewhat normal day. Sometimes I have to slip away from my desk to go to the bathroom or to my car just so no one sees me crying.
There's been a tremendous amount of guilt. Guilt because I'm just not able to do the things that I used to be able to do. I'm not able to help people like I normally would. I'm not able to be as active with my children. I'm not able to be a really good companion to my husband. Not able to be there to help take care of my parents and to be there to help support my sister. I've lost friendships because of this disorder, because I was no longer able to be the helpful friend. I've had loved ones tell me that I just need to get over it, that it's all in my mind, that I'm making it up, that I need to stop being so needy.
I'm not sure why God put me on this path.
This illness has taken my life from me and turned it upside down. It has taken friendships, my job, all of my family relationships are strained. It has really ruined my life.
TN has kind of reconstructed my face, and I gained 50 pounds from all the medications. I've lost 22 of them, but 50 pounds is a lot of weight to gain.
I lost my job. I had to stop proceedings for child adoption, and it really took a toll on me mentally and physically.
It destroyed who I was, and it destroyed me.
This is reality for trigeminal neuralgia patients, and like all warriors, they keep fighting, hoping for a cure.
I really hope a cure is found soon so people won't have to suffer like I am.
I pray that my story and everyone else's story that's being shared will help others out there, will help spread the word, spread awareness for our disorder.
But I'm not going to give up.
TN might have taken our way of life away as we know it, but we're not letting TN take away our lives.
Please spread the word and help us find a cure.
That's my story in a nutshell.